Anyone who relies on these types of intensive care for children is potentially at risk of running out of beds or having to take more drastic measures.
Oregon's 2 children's hospitals and 1 pediatric unit have declared a crisis standard of care because of a surge in RSV affecting mostly young children. The hospitals impacted at our OHSU's Doernbecher, Randall Children's Hospital, and Providence St. Vincent's pediatric unit. Katu's Christina Giardinelli is live for us in Salem after talking to officials about the crisis and really what it means. So what should patients expect, Christina?
Well, it's really important to keep in mind that the crisis system of care involves a few different levels of emergency. You might remember during the pandemic, some states and some hospitals in different states had to ration care. That is not the point we're at, and I want to be really clear. We are not at a point where we're rationing care right now. The level that we're at just means that hospitals are adjusting some of their practices to squeeze in a few more patients. Oregon's 2 general children's hospitals are at capacity because of a surge in RSV amongst children. The hospitals declared a crisis level of care, which allows them to bring in more patients than usual. Dr. Jennifer Vines is the Multnomah County Health Officer.
It's driving anywhere from 1/4 to 3/4 of hospitalizations, in particular among infants.
Officials say most of Oregon's emergency departments are not equipped to handle intensive pediatric care. That's why the surge is putting the 2 children's hospitals in crisis care levels. And Loeffler is a Multnomah County Deputy Health Officer.
The little babies have always been at the highest risk, in part because it might be the first season that they're picking up RSV and because their little airways are so tiny.
She says households with kids under 3 or adults over 70 should be rethinking their Thanksgiving plans.
It's hard to have that conversation, but consider the possibility of calling that host and saying, you know what, I think we have to delay this.
Officials say hospitals are not at the point of rationing care, but crisis care may call for that at some point. OHA has strict guidelines for hospitals in crisis care levels. They include making sure care is equitable and being fully transparent with patients and the public. Despite multiple calls and emails over the past 24 hours, none of the hospitals made time for an interview. Dana Hargunani is the Oregon Health Authority's chief medical officer.
What will OHA do to make sure that hospitals are providing the transparency that is required according to your toolkit?
Well, I think the first step is we will try to identify exactly what information is not being shared. We're happy to work with you.
All the emergency departments, the pediatric hospitals, the intensive care units are overflowing.
Deputy Health Officer for Multnomah County, Dr. Ann Loeffler, says that's the reality Portland area hospitals are facing right now. She says they're trying to spread the word in the hopes more families will take precautions to keep their kids healthy. Because if not,
if we lose the capacity to take care of the new kids who are coming in, kids will not get the best care that we want for them. And that'll be the case whether they have a pneumonia, have RSV, or if they're in a car accident or, a broken bone.
In light of that, what would you recommend then for people who are planning to gather for the holiday season and gather with kids?
If you have little kids, like your kids are less than 2 years of age, or maybe your toddlers haven't gotten RSV or an illness that your doctor thinks was probably RSV in the last couple of years, honestly, you should probably plan to not gather with other families, especially those who have sick kids.
Which may sound a little extreme coming on the day before Thanksgiving. However, Dr. Loeffler says the situation inside hospitals is extreme. But if you have small children and still want to gather for some turkey, Dr. Loeffler says limit your child's exposure as much as possible.
Practice saying, you know what, I'm sorry, right now, I just have to be extra cautious and we're just not passing the baby around today.
And pediatrician Dr. Ryan Hassan says vaccinations can help, and not just the COVID one.
Get vaccinated against everything that you can. Only half of Americans typically get a flu vaccine.
Yeah, it's not a record you want to break. According to stats we got from the Portland Police Bureau, homicides were up more than 50% in 2021. That was up from 2020. Now, this year, with the 2 shootings we had last night, including one here at this 7-Eleven in Northeast Portland, Portland seems to be continuing that violent trend. Wednesday night, we saw 2 shootings in 2 different parts of the city that claimed 2 lives. One at a 7-Eleven in Northeast Portland, another at an apartment complex in Southeast, very close to where Allie DeShio lives.
Yeah, this is on my running route. It makes me a little hesitant to come down this street. You know, I already feel hesitant to run in the dark alone, especially as a female in the city.
According to data from Portland police, with Wednesday's killings, Portland has now seen 88 homicides in 2022. That's the same number as last year's total, which, as you can see, was a record for Portland. A record no one wants.
It's discouraging. I mean, I never thought, even with the defundment and disbandment of GVRT, we'd ever see this level of violence.
That's head of Portland Police's Focused Intervention Team, Lieutenant Ken Dulio. He says almost every type of shooting has gone up in Portland since the summer of 2020. Even aspects of shootings like the amount of bullets used have gone up.
I mean, in the 10 years that I worked the gang enforcement team in GVRT, I went to hundreds of shootings, and the most casings at any scene I responded to was in the 50s. Is very common to go to shootings now. We have casings between 50 and 100, some over 100.
Lieutenant Dulio says part of the problem is that people retaliate for shootings with shootings and create a cycle of violence. I asked him what they're doing to get ahead of this trend.
It's all hands on deck, and we're taking, every shooting we can. We even have officers outside of our unit, that work the precincts that have other primary duties and responsibilities that are doing their part on trying to get ahead of this gun violence.
But he said ongoing staffing shortages at the Bureau limit what they can do. Now, we also asked Portland Police about, any information, any updates in the investigations into the 2 shootings that happened last night, but they weren't able to share any details with us, any more details, that is, than they already have, including any on potential suspects.